When patients come to me interested in liposuction, one of the common questions I hear is, how much weight am I going to lose? Or I had one patient came in, she goes, I want to lose 100 pounds. I want liposuction to get me kick-started. And I tell patients, liposuction is not a weight loss program. You are not going to lose weight with liposuction. It's more of a redistribution of the fat, if you will. If I take someone to surgery and I take 10 pounds of fat out and they maintain their same level of dieting and exercise, they will weigh the same a year from now as they did the day of surgery. Liposuction, it has changed a lot over the years. Back in the 90s, we would bring someone into the operating room, we put them asleep under a general anesthetic. We made a fairly large incision. Some of you may have seen on TV or some of the videos, some of the cannulas that we use to go in and remove some of these fat cells. We use much larger cannulas, much stronger suctioning devices to remove large cores of fat. But we got into all sorts of problems with infections and scarring and ripples and irregular contours. Things have refined a lot, and we're using much, much tinier cannulas. We now sometimes use the term liposculpture because we can actually sculpture out the areas that we want to treat. We can sculpture in the appearance of a six-pack. We can sculpture in a contour underneath the buttock, and we can really contour things the way we want them to be. Liposuction is not necessarily for someone who's heavy or someone who's light. Liposuction is for someone who is at or close to their ideal weight, or at least at the weight that they plan to maintain. And we do liposuction to smooth out those irregular contours to get their contours stable. Once we get them to look good, liposuction is kind of a permanent treatment. Once those fat cells are gone, your body does not replace fat cells. So once I remove fat cells from a problem area, those fat cells are gone. You will not tend to put fat back on in those areas.